the debate continuing on as President Trump's big beautiful bill this week, many are raising concerns about proposed cuts to Medicaid. Kansas Governor Laura Kelly says those cuts would put rural Kansas hospitals in danger of closing.
One of those hospitals is the Caldwell Regional Medical Center. Sophia Jernander spoke with the hospital's CEO as he says Medicaid cuts could be disastrous for them.
The Caldwell Regional Medical Center is in danger of collapsing if President Trump's Medicaid cuts pass the Senate. And here in rural southern Kansas, this hospital provides health care to dozens of small communities near the Oklahoma border.
It would have an impact on us, there's no doubt about that.
Chris Graham is the medical center's CEO. He says that the facility has only been around for 2 years, but has already filled a much-needed gap for south central Kansas.
We have inpatient services, lab, radiology, rehab.
Now this is threatened by the president's big beautiful bill, which is expected to pass the Senate this week.
It would have an impact of over $400,000 in payments from Medicaid that we would not receive.
On a virtual call on Thursday, Governor Laura Kelly says Kansas did not expand Medicaid. She says this would create disaster for many hospitals like Caldwell's.
If this bill were to pass, those hospitals are going to get another huge hit. And I think will actually be the death knell for a number of them.
Graham says the cuts could leave older people in the communities they serve with no other option than to travel long distances for health care.
Folks that have come here for their care would have to go, and travel, probably to Wichita.
And he says he hopes the senators remove Medicaid from the bill because it would cause chaos for the hospital and entire community.
If you cut that, it's going to lead to more people that are not insured, and it's going to create a real problem.
In Caldwell, Sophia Jernander, 12 News.